You want to see Nana? We're off to see Nana, darling, but you stay here. All right, bye-bye, beautiful.
Bye, Mum. Bye.
Kimberly Luffman is about to see her nan for the first time in months. Family visits to her aged care facility stopped during Sydney's lockdown.
No, it's been a really tough few weeks for her towards the end of lockdown, but I think it's still great to go in and see her and be able to give her a cuddle and help her when she's feeling a bit low.
Uniting Annesley in Sydney's inner west is for people living with mental illness. 2 fully vaccinated people over the age of 12 can now visit each resident. They must follow strict COVID checks and wear masks and shields.
Hello, boss.
Hey, bro.
Mix.
Hey,
Let's look at different, my God.
Gratian is ecstatic to see his friend Joseph.
He is a Polish.
Robin and her husband are armed with gifts, including fresh gossip magazines for her mother Pamela, whose mood has been a bit flat lately.
We've done everything we possibly can, like having vaccinations, the checks before coming in. So I just think we do have to move that way because, as I could see with my mum, she really needs that contact.
It's an overwhelming reunion for Kimberly's nan, who makes it clear she really needs more visits.
I can't manage to do things and everything. That's where I need help.
Can I have a big cuddle just to try and help? She wasn't worried about getting the virus. I think, as she would say to me, Kimberly, I've had my 75 years, but I want to be able to see my family.
The restrictions in residential aged care have impacted older people in a really significant way. Things like you and I would be able to go and sit in our lounge room and watch a movie or watch that with our family. That's been limited in residential aged care.
COVID restrictions in Victoria and the ACT mean family visits to aged care facilities are only possible under limited circumstances. Craig Gear's advocacy organisation has been receiving complaints about onerous restrictions on family visits in New South Wales imposed by some aged care providers.
We are seeing people and providers who are being overly restrictive, who are limiting the times that people can come in and shortening the length of time that people can visit for.
It's been a stressful time for Anthony Bowe, whose mother lives at Newmarch House in Sydney's west. She got COVID during an outbreak last year where 19 residents died.
Well, Mum got COVID April 2020. She didn't suffer any respiratory problems, and that was probably the difference between her surviving and not surviving.
Last month, a doctor who had visited the home tested positive, forcing residents to isolate in their rooms. Anthony is nervous about what else might happen.
Society opening up again, more visitation. It's a really dangerous time for the elderly.
The aged care regulator told 7:30 Newmarch House had not complied with quality standards during the doctor's visit. It's issued a notice requiring the home to appoint an advisor and train staff in infection control. The regulator's last site audit was conducted in January and a different non-compliance notice was handed out.
They rule the industry with a feather duster and not an iron fist.
Newmarch House is run by Anglicare. In a statement, Anglicare said the doctor was screened prior to entry but declined a rapid antigen test. The home activated an outbreak plan and no residents or staff tested positive.
If, as you say, that the regulator has been aware of that situation, then you would say that is the regulator doing its job. But I'd also say that, that there can't be any room for complacency for anybody on the front line.
The Aged Care Royal Commission's damning findings revealed the failure of infection control practices to stop the spread of the virus. In response, the federal government made it compulsory for homes to have a trained staff member in infection prevention and control.
It has been a huge wake-up call, and I think that if you just see the numbers of, staff who are coming now to be trained, that really demonstrates that we've gone from, perhaps training 20 or 50 people a year now to over 3,000 just this year.
Yeah, good one like that.
The aged care industry is confident enough changes have been made to reduce the likelihood of large outbreaks. Mandatory vaccination for aged care workers is in place and 86% are fully vaccinated.
We've seen staff being constantly upskilled and trained with the use of PPE and having greater supplies and access to PPE. We also have outbreak management plans in every aged care home.
Whether or not the facilities themselves have put in the hard yards to do that, I guess that will, the proof will be in the pudding, so to speak.
Today's visit has been challenging, but Kimberly Luffman is hopeful her grandmother's spirits will lift.
So I'll need to be visiting much more regularly, taking time with her, trying to take her out of the centre, and she will bounce back, but it'll take a couple of weeks, I think.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.